me, a learning healthcare system is a way to organize care, and it's making sure that all the participants in that system, and by participants that's patients, family, caregivers, their physicians, providers, it could be researchers, if there's researchers, the community, all of these participants in the system are aligned around a common goal or goals, and they're really interacting in such a way that we're constantly learning and taking that learning and feeding it back into the system so that we have this continuous learning, really continuous quality improvement and value generation, and so it's a cycle. The patients, the providers, management and researchers, if they have them, those four elements, where they're all aligned, and there's a culture that supports this continuous learning and engagement so that we are integrated in terms of the types of things we're capturing, and we can then feed that back and constantly improve and drive value and make things better. First way is how they can engage patients, by organizing so that patients feel as though they're a part of the system and not just being sort of seen as a customer or a consumer. They really become integrated into the quality improvement process. They feel they're a part of the system. They feel that they can contribute through research. The other side is value to the hospital and the staff. So if we're organizing that we're able to see gaps, capture data that we can then use to become more effective and efficient, that's really valuable to the organization. The same thing in terms of the learning. If we learn in one part of our organization, then if we can take that learning and put it in another part of the organization, and the words we tend to use, scale it, so make it bigger and generalize so that everybody can use that same kind of thing. A lot of the hospitals are doing really great work and are doing these learning health system activities, and the next step for them is really to be able to take those activities and roll them out and really organize so that everybody across the system is benefiting: the patients, the providers, managers, researchers. I think another area is understanding what we mean by the system. If we define that system bigger in terms of our neighborhood or community, we can then begin to bring in different participants and really understand what's driving the patient's outcomes and their well-being, as well as our staff, and thinking about that broadly. What creates a good environment, and that's part of the learning healthcare system.